Picture this: a quiet afternoon, a low-grade fever, a red spot on the leg that looked like it would heal. Family thinks it's nothing. A few hours later, the person is confused and breathing fast. Their skin looks strange, clammy, pale. That sudden change is sepsis showing up the way I see it in real life, and it moves fast. Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and today we're going to learn how to spot sepsis early, act quickly, and know what to expect when you get help. Let's separate medical fact from fiction. Why does this matter? Because sepsis is one of those emergencies where every hour counts. Delay in starting the right treatment increases the risk of organ damage and death. But there's good news. Early recognition by a caregiver or patient often changes the outcome. So this episode is about practical, nurse-approved steps you can actually use. First, a very quick story. A few months ago, I cared for an older woman whose family assumed fatigue was just getting older. Within hours, she became disoriented. They called, we evaluated her immediately, and we started treatment. That quick action made the difference. I tell you that because these moments are often small, but decisive. Okay, what is sepsis, simply put? Think of an infection as a localized fire. Your immune system is the sprinkler system. Sepsis happens when the sprinklers go haywire and water starts damaging the whole building. In medical terms, it's a dysregulated immune response causing organ dysfunction. Important, sepsis is not a single germ. It's how the body reacts to an infection.
Where does it come from? Common sources include pneumonia, urinary tract infections, infected wounds or skin infections, and surgical site infections. Less obvious sources are infected IV lines, abdominal infections, or an infected device. Risk increases with age, diabetes, recent hospitalization or surgery, weakened immunity, and implanted devices. But remember, a healthy person can get sepsis too.
Now, and this is the part I want you to really hear, the early warning signs. These are things you can notice without a stethoscope. First, a change in mental status. Is the person confused? Hard to wake? Not acting like themselves? That's a red flag. Second, breathing. Are they breathing faster than normal or struggling to catch their breath? Third, temperature. A fever is common, but a low body temperature can also be a sign, especially in older adults.
Fourth, heart rate. A racing pulse is often an early sign. Fifth, urine output. If someone who usually pees several times a day suddenly produces very little, take note. Sixth, skin changes. Clammy, mottled, very pale, or unusually warm skin matters. Any combination of infection plus one or more of these signs should push you to act.
Signs look different in different people. Children may be very sleepy, refuse fluids, or breathe rapidly. Older adults might not run a fever. Confusion or a fall can be the only clue. People on immunosuppressive meds can show very subtle symptoms. When someone is higher risk, err on the side of caution.
Listen, if you suspect sepsis, act now. Don't try to wait and see if the person is getting worse. Call emergency services or get them to the emergency department. That's step one.
While you wait for help, there are safe, practical things you can do. Stay with the person. Keep them comfortable and reassured. If they can swallow and are alert, offer small sips of water, but don't force liquids. Try to document a few quick facts: when symptoms started, recent infections or surgeries, current medications, and chronic conditions. These details help clinicians move fast.
Measure what you can: temperature, pulse, respiratory rate, and urine output. You don't need perfect medical tools. A simple count of breathing or noting how often someone pees is valuable. These quick observations are the facts that guide early treatment decisions.
Here's an exact script you can use when you call 911 or talk to triage. Say, my loved one has an infection and now they are confused and breathing quickly. I'm worried about sepsis. Please send help right away. That clear wording signals urgency. After that, add, they had surgery, UTI, wound recently, and they take medication name. Specifics matter. they help people triage faster. When you arrive at the emergency department, things move quickly, and that's intentional. First, they'll check vitals and get IV access so blood can be drawn and treatment started. Second, you'll likely hear about blood cultures and a lactate level. Third, broad-spectrum IV antibiotics are often started as soon as possible. These steps are aimed at stopping the infection and supporting organs. They'll also give IV fluids to support blood pressure and monitor urine output closely. Imaging, like a chest X-ray or CT scan, may be ordered to find the source. Some people will need more support, like medications to raise blood pressure or surgery to control an infected source. Care is rapid and coordinated because timing matters. Let's bust a few myths now. Myth: sepsis always means a very high fever. Not true. Older adults and immunocompromised people can have low or no fever. Myth: antibiotics alone fix sepsis. Antibiotics are essential, but fluids, monitoring, and treating the infection source are equally important. Myth: you can safely wait at home to see if someone improves. Don't. If you see warning signs, get professional care. Prevention is practical. Keep wounds clean and covered. Follow post-op wound care. Finish prescribed antibiotics when indicated. Practice hand hygiene. Stay up to date on vaccines, like influenza and pneumococcal if you're eligible. For people with catheters or central lines, watch for redness, leaking, or pain, and report it early. Before we close, 3 clear takeaways you can use right now. 1. If there's an infection plus any change in mental status, breathing, heart rate, urine output, or abnormal skin, seek emergency care immediately. 2. When you call, be explicit. Say infection, confusion, rapid breathing, recent surgery or device. That short script gets attention. 3. At the hospital, expect rapid testing, early antibiotics, and fluids, and ask the team about blood cultures, the antibiotic plan, and monitoring so you understand the next steps. A final important note. This episode is educational and not a substitute for emergency care. If you suspect sepsis, act now. Err on the side of getting professional help. Early action literally saves lives. If this helped you, subscribe so future episodes find you and the people you care for. Share this with one person who cares for someone at risk. It could make a life-saving difference. If you want to learn more about my consulting work or schedule a conversation, you can find me at FAQ by nursejessicaconsulting.com. Thank you for listening. I'm Jess, and I'll keep bringing practical, nurse-approved guidance you can trust. Until next time, stay informed, stay compassionate, and always put safety first.